What is the Halachic definition of brain death? Imagine a person lying in a hospital bed, unresponsive, with no signs of breathing on their own. Is this person alive or dead? That question has sparked much discussion among Jewish legal authorities. Today, we will explore how Jewish law defines brain death and what it means for organ donation and medical ethics. In Halacha, or Jewish law, the traditional way to determine death has been based on signs like the cessation of breathing and heartbeat. These signs are clear indicators of life. But with advances in medicine, we now have situations where the heart continues beating with machines, even though the brain no longer functions. This has led to debates about whether such a person is considered alive or dead according to Jewish law. Brain death refers to the irreversible loss of all brain functions, especially those of the brainstem. The brainstem controls essential functions like breathing, heartbeat regulation, and reflexes. If the brainstem stops working permanently, the person cannot breathe on their own. Medical tests are used to confirm this, including checking for responsiveness, reflexes like gag or cough, and whether the person breathes spontaneously without assistance. These tests are repeated after a certain period to ensure the condition is permanent and not temporary. Many Halachic authorities accept that once the brainstem has irreversibly ceased functioning, the individual is halachically dead, even if the heart still beats because of mechanical support. They compare this to the classical signs of death mentioned in the Talmud, such as decapitation or cessation of respiration, which are seen as definitive signs of death. For these authorities, brain death is akin to physiological decapitation, meaning the person is no longer alive in a halachic sense. However, not all rabbis agree. Some maintain that death only occurs when the heart stops beating naturally, without mechanical aid. They argue that as long as the heart is beating artificially, the person is still alive. This disagreement impacts decisions about organ donation. If brain death is accepted, organs can be taken from a brain-dead person because they are considered deceased. If not, removing organs before the heart stops is viewed as killing, which is forbidden in Jewish law. Prominent rabbis like Rabbi Moshe Feinstein accepted brainstem death as halachic death, allowing organ donation under those conditions. The Chief Rabbinate of Israel also endorses brain death as a valid halachic definition, citing classical sources that link death to the end of respiration. Some authorities requiring all brain cells to be dead before declaring death, while others focus solely on the loss of brainstem function. In practical terms, if brain death is accepted, organ donation becomes permissible and can save lives. If it is not, then medical procedures must be carefully aligned with halachic rules to avoid violating the prohibition against killing. This ongoing debate continues to shape medical practices and ethical decisions in Jewish communities worldwide. So, the halachic definition of brain death hinges on the irreversible loss of brainstem function and spontaneous breathing. Many authorities see it as the moment of death, but others hold a different view, making this a lively and important discussion in Jewish medical ethics.